proceed with our briefings as follows. Sir?
Thank you, Mayor Cantrell, for having me here today and the opportunity to meet with you and your team and for the partnership that we have established a long time ago, but that is certainly, I think, very important to us right now, given what we're dealing with this growing COVID-19 outbreak. We just ended a meeting of our teams where we shared information about our plans going forward in response to the coronavirus. Also talked about a proclamation that I issued this morning and making certain that we have seamless communication and coordination. As you probably know, about an hour ago, President Trump declared a nationwide public health emergency, and I certainly thank him for that. This is a very serious situation that demands the full attention of our nation and our state. There was a lot of information that was delivered just a short time ago and a lot of information to unpack, and I'm not going to have an awful lot to comment on from that press conference that just concluded. Suffice it for now to say that all of our state agencies will be digging into the information that was provided to find out how we can take full advantage as soon as possible for the state of Louisiana. An update on the testing that we have. As of right now, we have 36 presumed positive cases of coronavirus in Louisiana. Those cases are spread across 8 parishes. That is 13 new cases since yesterday, and the new parishes include St. Bernard, St. Charles, and Terrebonne. As we've noted before, there's a community spread of COVID-19 in New Orleans and potentially beyond. We know that there is one cluster of cases at Lambeth House here in New Orleans, which is both a nursing home and assisted living facility. Obviously, this is a very serious situation for our entire state, and it requires serious action. We've said this before and cannot stress enough. Those who are most vulnerable to COVID-19 are our elderly and those with chronic health conditions. And that is why yesterday steps were taken to limit non-essential visitation to hospitals, nursing homes, state prisons, and parish jails. But younger people play a role too. While you may not have symptoms, you could spread the illness to those who will, and I implore you to stay home if you are even slightly sick. And that's the entire population. Don't go to work. You know, it's time to be good neighbors to one another, and this is one of the things about being neighborly. So the proclamation that I issued does the following. In an effort to reduce and limit the spread of COVID-19 in Louisiana and to preserve the health and safety of all members of the public, all gatherings of 250 people or more between Friday, March 13, 2020 and Monday, April the 13th of 2020 shall be postponed or canceled. This applies only to gatherings in a single space at the same time where individuals will be in close proximity to one another. It does not apply to normal operations at locations like airports, medical facilities, shopping centers or malls, office buildings, restaurants, factories, manufacturing facilities, grocery or department stores. For example, please go to the grocery store if you need to. Go to the mall, go to the pharmacy. However, if you are in a high-risk category, meaning you are elderly or have an underlying health condition, think twice about going out, and if you do, please practice social distancing. This provision may be extended beyond Monday, April 13th, 2020 by further order should the circumstances warrant that. To be very clear, and I think this will probably get to some questions before you ask them, this prohibition does apply to churches and houses of worship with congregations that exceed 250 in a single service. However, churches and places of worship can engage in multiple services and bring the number of people in them below 250. It is important, and this is probably the one time a week where we know that the most number of elderly people and people with chronic health conditions are sitting in pews next to others for at least an hour. And so while it's a very heavy decision, it was one that was deliberate to include churches in this particular executive order provision. This is in keeping with guidance, by the way. The entire limitation on the size of crowds at these different events, the 250, it is in keeping with guidance from the CDC on community spread. It is to do everything that we can to limit the spread of COVID-19 so that we do what we've been talking about. The peak of cases won't be as high as it otherwise would be, and that we don't create demand on our healthcare providers all at one time. So we spread out that demand over a longer duration. I know also there's a major concern about our schools. Beginning Monday, March 16th, all K through 12 public schools across the state will be closed for 30 days, with classes scheduled to resume on April the 13th. And like all of our announcements, this situation will be reevaluated as we continue to monitor developments. It's important to note that school cafeterias will remain open for as long as possible to provide food for those students who need it. We will give parents and caregivers the opportunity to give the maximum opportunity to parents and caregivers to make arrangements. And we realize that sometimes grandchildren are placed in the care of grandparents when school is out and parents are working. To the maximum extent possible, please work around this situation. Again, the elderly population is most vulnerable, and while children, thankfully, are not impacted nearly as severely as other portions of our population, they do have the ability to spread the coronavirus. So I know that some difficult decisions are going to have to be made, but I'm asking everyone to do the very best that they can to keep themselves and their families safe. All public four-year higher education institutions have announced that they're going to transition to online distance learning. The dates vary at each institution, so I would ask that you all in the public consult with them to get those dates, go online, go to their websites and so forth. As for our two-year institutions, Delgado, to the maximum extent possible, has already started its online classes. All other institutions within the Louisiana Community and Technical College system are preparing to go online as needed and as soon as possible. More information will be coming from the LCTCS system and from those institutions. Given the critical need of our healthcare system, we're encouraging all healthcare organizations to work with our medical students to keep them in their clinical rotations and on the job. Second, while ensuring that state government remains operational, we're going to lessen the need for face-to-face interaction by the public at agencies such as the Office of Motor Vehicles. In addition, each agency is granted the authority to determine if part of its workforce can and should work remotely. I am also directing cabinet secretaries to find ways to reduce the need for in-person meetings with the public and with various stakeholders. We are also asking all state agency heads to identify and maximize opportunities for their employees to use telework while maintaining their normal functions. Thirdly, we are adjusting our election schedule. As recommended by, and because I agree with the Secretary of State, Kyle Ordman, later today I will assign an executive order to move the April and May elections to the June-July timeframe. This will obviously include the presidential primary. The reasons include taking into account the older age of the majority of precinct volunteers and workers and the need to reduce public contact, and also to allow maximum participation by all voters regardless of their age and their health conditions. Also, the Louisiana Public Service Commission has issued an executive order prohibiting all public utility companies from disconnecting customers for non-payment of utility bills statewide beginning today until further notice. The time for serious action is now, as our presumed positive cases number continue to rise. We must be vigilant to protect all Louisianans, especially as we see cases spread to different parishes. We must come together as Louisianans and do what we do best, and that is be good neighbors to one another, be resilient. We are a state that's been tested and tried many times, and this test, to be sure, is a little different than those that we've faced in the past. But when we unite to help each other, our strength is far greater than we realize. We must be responsible citizens and good neighbors. It's obvious that we're not alone in taking such serious actions. At least 5 other states have made similar announcements today and yesterday, much of the sports world took necessary steps to prevent large gathering and protect fans and athletes. Even Disney World, for example, will close its doors for a period of time. Our colleges are arranging to have online instruction. All of us are considering how to arrange our lives to avoid unnecessary interactions. And I want to take another opportunity to stress the way in which every single Louisianan, everybody in Louisiana right now, these are the things that you can do to help us to make sure that we minimize the spread and the adverse consequences of the coronavirus. Wash your hands frequently and do so for at least 20 seconds with soap and water. And by the way, there's a lot of focus on hand sanitizer. That is not the best method to clean your hands anyway. The best method is soap and water, which remains readily available. So please use it and do that frequently. Cover your cough and sneeze into your arm if necessary. Avoid touching your face as much as possible. Routinely clean and disinfect frequently touched surfaces. Avoid close contact with others and stay home if you are sick. We started a public service announcement campaign with LSU head football coach Ed Orgeron and U.S. Surgeon General Dr. Jerome Adams. They can be seen on television and heard on radio, and they're also on social media. We ask that you take heed to and share these messages as much as possible. It is my fervent belief that the sooner we minimize the spread of adverse health consequences from coronavirus, that the sooner that we're going to return to the Louisiana way of life and get back to normal. But there is some period of time where we're going to have a new normal. And we expect that these cases will continue to increase for some period of time. And so we want to make sure that the public also has that expectation. But that's also why we're calling upon them to really make sure that they are doing those things that we've asked them to do as a precaution to minimize the spread. So I'm going to be followed now by the mayor, and I want to thank her again for the opportunity to visit you and your team and for the work that you and all of your team is doing. Thank you very much.
Thank you, Governor. And it's good to have you here, good to work with you and your team. And I appreciate your commitment to Orleans Parish and the state of Louisiana as we deal with COVID-19. As expected, the number of additional cases have increased, not only overnight, but even as we were having our recent briefing, that number increased. And we do anticipate, as it was reported, more cases to come. We are seeing significant community spread. To limit and slow down this spread of the virus, our best tools are that to mitigate, and we are moving forward with our mitigation efforts. That means closing of the schools. It also means canceling public events. As you've heard from our governor, all schools statewide are being closed for 30 days. Staying in communication and collaboration with the Orleans Parish School Board, NOLA Public Schools, our independent operators, as well as the Archdiocese of the City of New Orleans. They're doing everything possible to create distant learning environments. OPSB and NOLA Public Schools have been working with our schools for the past weeks to prepare for this. Each school will be communicating independently and directly with families on the steps and resources that will be provided to support an ongoing student learning environment. So again, the schools will be communicating directly with families, with parents, as it relates to the schools where their children attend. New Orleans Public Schools is also providing support across schools and will be identifying additional citywide and system-wide needs. NOLA Public Schools, in collaboration with charter school leaders, with the Mayor's Office of Youth and Families and other agencies, we're coordinating a prolonged effort to ensure child nutrition services during this time, making sure that nutrition meals are available to our families and to our children throughout the next 30 days and beyond should we need to. A request was made to the USDA and was granted as it relates to nutrition for our students, for our families. This also speaks to children not only in school but also across the board citywide, all of our children. The district will share resources with families for how they may access food and nutrition services, again, during this time, and also starting with next week with the school closure. They're asking for, after that first week, the district anticipates a citywide child nutrition program that will be available for all of our families throughout the city of New Orleans. To support both functions, the Orleans Parish School Board, and thank you so much, OPSB, for doing this, passed a resolution granting NOLA Public Schools the authority to access $5 million for emergency spending needs. We appreciate that very much. As you know, the state has issued guidance limiting public gatherings to 250 people. The governor went through this very thoroughly. Here in Orleans Parish, we want people to use, of course, common sense and good judgment as it relates to this. We're seeing even with some businesses are practicing their own or instituting their own limitations of people who are frequenting their businesses, maybe 50 at a time, some 10 at a time. But this will be determined by the private industry and the businesses themselves. Enforcement will be complaint-based. And we'll respond as needed. The New Orleans Police Department is urging citizens not to gather in large groups until further notice to help slow down the spread of COVID-19. Again, this is coming from our New Orleans Police Department, and again, enforcement will be complaint-based, and we will respond. Please do not block public streets or intersections. It is a public safety risk without proper police presence. This also, again, speaks to the cancellation of public events, those that are permitted through the city of New Orleans. We're not going to be, out counting heads. We trust that our people will follow the rules and just be good citizens. Public safety and public health remain our top priority as we move through this, and continues to. In addition, we will be restructuring the access to City Hall and city facilities. More of this will come. This will be a minimized and staggered approach as it relates to accessing City Hall. We will not allow more than 50 people, for example, to access City Hall. These practices will begin on Monday. Again, we will provide you with more information today as the processes are being finalized. City Hall is not closing. Your city government is functioning, and we are here to make sure that government runs for our residents, for our visitors, for our businesses. It's very important. City Hall is not closing. But again, we're making efforts to limit contact and reduce large groups. This also speaks for our employees, in which we will be communicating directly to employees of city government. City employees that are impacted by this outbreak will be placed on civil leave. Again, making sure that our people are consistently being paid. Also, this is paid leave. Okay, civil leave is paid leave. And we're calling on and encouraging private employers to do the same. What I do know, and from the Hospitality and Tourism Committee call this morning, many of our hospitality industries, in terms of hotels, are implementing their own policies, PTO, paid time off, for an extension of 14 days. This is not every hotel that I can report at this time, but you should know conversations are being had, and we're making progress with that. My next call with this Hospitality and Tourism Committee will be at 4 p.m. This afternoon. Let's see, all meetings, and this is from our New Orleans City Council, we've been working hand in hand, but all meetings of the council, committees, and regular meeting will be suspended at least until the end of March. The council is closing the chamber for use by boards and commissions and is urging them to take similar actions. We've been communicating with our boards and commissions across the board. They have been notified. I do anticipate, and the governor will move forward, asking a resolution of the legislature to suspend public meetings laws. This is important for the city of New Orleans as it relates to our ability to continue to do business. During the council or the chamber closure, the council offices will remain open to serve their constituents, and preferably, by phone. We're doing a lot of conference calls these days. We're not breaking any public meeting laws at this time. We don't plan to break any laws, but you do know we are having effective conversations with multiple stakeholders throughout the city of New Orleans. I've organized over 13 committees of our stakeholders. These committees range from neighborhood leaders, faith-based communities, hospitality and tourism, as I mentioned, the business community, primary schools, which includes pre-K through 12, committee for colleges and universities, housing and independent living facilities, nonprofit community, transportation, utilities, vulnerable populations. It really goes on and on, but the city is organizing ourselves, therefore, the way that we communicate with all of our stakeholders city-wide. I had as I reported on yesterday, a neighborhood leaders conference call where over 1,600 residents participated on that call. I do anticipate scheduling another call with neighborhood leaders, and that information will be forthcoming. We are working very closely with our fellow elected leaders, both on the local, state, and federal levels. Yesterday, as I reported, I formally reached out to our congressional delegation for support at the federal level, and they've been extremely responsive. And as it was reported, our president declared a national emergency, and that really does help. It unlocks resources at the state level, and of course, that benefits us locally. As with the declarations the governor and I both issued yesterday, again, this will unlock additional resources, and we will update you as we plan and also facilitate any other public assistance for individual assistance. We'll be making this information readily available. I have Also, I wanted to thank our community partners, particularly the Greater New Orleans Foundation, who has activated our disaster fund, and they are also a co-chair representing us on the nonprofit committee. United Way also stepped up, making available over $100,000 that has been contributed to this disaster fund. Let me tell you what we are not doing. We are not limiting the sale of alcohol. That was something that seemed to have been misconstrued based on the declaration that was made on yesterday. What it says that should it be necessary, that I have the authority to do just that. But as of now, we are not limiting the sale of alcohol. We are not shutting down private businesses or forcing them to close. While these closures and cancellations are extremely disruptive, the work of the city, it must go on. So the public health, again, is public safety, and that is our top priority. What I will ask right now is for Dr. Jennifer Avegno, who serves as our Director of Health, to come and give us the most latest updates and briefings at this time. Dr. Avegno?
Thank you, Mayor, Governor. As the governor said, we have 36 presumed positive cases in Louisiana. There are 26 presumptive positive cases of COVID-19 right now in New Orleans, and we expect that number to rise. This situation clearly indicated to all the leaders here that significant community spread of the virus and the time to act is now. We have to do, as you've heard, we have to do everything we can to protect those who are most vulnerable, the elderly and the chronically ill. What we know of this epidemic is very clear, that they are affected far more severely and at much higher risk of death than others. The best way to do this is to slow the spread of the virus, as we've said, by significantly reducing interaction between individuals and groups, and that is why the decision was made to close schools, limit access to public facilities, and limit social gatherings. These are all ways that the virus is spread from person to person. What we need to do now, as I've said before, is to flatten the curve of this epidemic. I want to reiterate that we are not taking these measures largely because of the risk to the average person. Relatively healthy people who contract COVID-19 tend to have mild symptoms like the flu or a cold and do not require hospitalization. However, elderly individuals, those with chronic medical issues are at far greater risk for severe illness. I can't emphasize this enough. These are the people we do not want to contract the virus. And all 400,000 New Orleanians and all Louisianians have a role to play in protecting these individuals. On our public safety side, as the mayor said, we are all hands on deck. Our public safety agencies are equipped with personal protective equipment and will be utilizing it when responding to calls with flu-like symptoms. 911 call takers are trained to ask specific questions to determine if a call for assistance might be from a patient at risk of COVID-19. The New Orleans Police Department is asking for your cooperation in following the governor's ban in gatherings of more than 250 people. It is very important that we all reserve emergency services for those who truly need them. If you have a fever, cough, shortness of breath, or other symptoms, please call your doctor. We urge the public only use 911 in hospitals for life-threatening emergencies. We have been through a lot as New Orleanians, both recently and both in our history, and the sacrifices and changes to daily life we're asking you to make during this time are no different than in previous times. Be in touch regularly with your elderly and chronically ill loved ones. Call your neighbor, your family member to see if they need help. We can still be community even if it's not in person. There are also real ways that you can help the people most affected. The best way to support in a crisis is to offer financial donations. As Mayor Cantrell said, yesterday the Greater New Orleans Foundation activated the Disaster Response and Restoration Fund, which will help nonprofits taking care of our elderly, homeless, and low-wage workers. Today, the United Way also announced a $100,000 contribution to that fund. The New Orleans Council on Aging is taking financial donations to support seniors through its Meals on Wheels program and other services, which we expect to increase. Second Harvest Food Bank is also accepting donations, monetary donations, and those of fresh produce, non-perishable food items, cleaning supplies, soap, and hand sanitizer. Please find an agency that is doing work such as these and find a way to use your energy, your time, and your talents to assist them. As we've all heard, there's a lot of rumors and misinformation out there. And I want to continue to reiterate, this is not a time to panic. It is a time for your continued attention. Information is one of the most important ways we can slow the spread of this virus. So please continue to make sure you're getting your information from reliable sources, including the CDC, the Louisiana Department of Health, and here in New Orleans, NOLA Ready. We're going to say it again. Text COVID NOLA, all one word, to 888-777. Follow us on social media at NOLA Ready. Go to readynola.gov for updates. Please understand that these decisions being made today on every level are not made lightly. Our cultural traditions, our gatherings, our churches are the backbone of our community. But to be community, we have to protect those most at risk. We will need to be creative, and that is something that Louisianians and New Orleanians are excellent at doing. So thank you all for your attention.
Thank you so much. Thank you so much. And one thing that we will continue to echo, that we are unified in our approach and our levels of communication, and we are extremely hopeful that we're going to get through this. We just remain calm, be patient, work together, and show the spirit of empathy that we know that we can, and that's by meeting our people where they are. So with that, Governor, you want to go ahead and take some questions?
Madam Mayor, the lens. This is for Mayor
Yes.
If there is a suspension of the public records law, can you guarantee that there'll still be advance notice of those meetings and live video feeds of those meetings?
Absolutely. Any way that we can make the public be involved and engaged, and whether that is viewing meetings remotely, we will absolutely put those measures in place. We're working through that right now through our IT department and determining what all of our options are. And so absolutely, this is only a method and a measure so that business can continue within city government. And there are projects that are in queue, development projects that we want to keep going. And I want to do the best that we can to ensure that work continues to happen.
Let's close out for a month. That's, we know it's going to put a strain on working families.
Sure.
Working families who are doing essential duties in our city. What are the city and the state doing to address childcare needs?
Well, they're really working through that now. We know, and as I mentioned, yesterday and the day before, as we've always not, really have been not wanting to get to the point where we've had to close schools, but we are here. And we knew that in doing so, that it creates an even greater disruption, and this is one of them. The impacts of child care, the impacts of even our workers being able to even work, and not just in city government, but in businesses throughout the city of New Orleans, our hospitality, our tourism industry, and the like. So we're all really putting our heads together in this regard to be able to meet the needs of our employees, but right now there is no coordinated effort, that I can report to you on right now, but just know that those conversations are being had, and we are laser focused on the needs of all of our people in the city, and child care is one of them. I think to the governor's point, and I know he'll want to add, but even him mentioning that, a lot of our elderly in some cases have been the backbones to, of our families that support system, and we're not wanting that to happen as it relates to the impact of COVID-19 on our elderly. Governor?
No, I think the mayor got it exactly right. What was very clear to me in consultation with the Department of Education today, as well as school districts around the state, was that we got to a point where obviously we don't want to be. There's not a single announcement that I or the mayor announced today that were things that we wanted to do. These are things that we felt compelled to do by the circumstances as we face them, because we are at an inflection point. We are trying to identify things that we can do to help with respect to the child care situation, and I think you're going to see some announcements perhaps around unemployment insurance benefits on an emergency basis in expanded capacity, and those sorts of things. But what we didn't want to happen was for school districts to start making the decision to close without adequate notice. So what we did is we made sure that people have the weekend to make the best possible arrangement that they can make for their school children. And look, this was probably the single of all the decisions that I made today that I announced. This was the one that was toughest to make, but I'm convinced, and I think we were the 7th state to affect school closures, and I think you're going to see a lot more of these coming, based upon the guidance we're getting from CDC and the things that we've been told to take into account for our decision making, and the fact that we're at an inflection point right now that it was essential to do it. And we know that we have strong, resilient people. We are telling them what they need to do to best protect themselves and their families from coronavirus, and we're going to help them everywhere that we can, but we need to give them the opportunity to have time to make the best possible decision for themselves, their families, and certainly their children.
Absolutely. And what I will also add to that, based on the governor's proclamation, is waiving the number of days as it relates to being in school. There's a threshold there. So with eliminating or preventing or bringing in the school closures for the next 30 days, that will not have, an impact on that required number. And that's he speaks to that in that proclamation. But I cannot overstate the leadership of our schools collectively, they have really been laser focused on not just child care, but on child nutrition. And so we're going to work through it. We're making some progress there as we reported on with nutrition, but they're leaning in.
The advocate followed by WVSU.
Governor.
Yes, sir.
Are any provisions being made for prisons and jails? And how does the down north gathering affect the meals and recreation, other gatherings within criminal justice facilities?
Okay, so we already took action with respect, and I think it was in my prepared remarks, and if it wasn't, I apologize, I just read right past them. But with respect to visiting nursing homes and hospitals, prisons and jails, we've already put a 30-day restriction on that. And it has to be essential visitation, for example, with respect to nursing homes. And this is something Seema Verna, who runs CMS, actually announced at the press conference the president had today. We actually took these actions yesterday. We are not allowing non-essential visitation because we have individuals, think about a prison, all those individuals living in close proximity to one another, and our prisons have relatively limited medical capacity as well. And so for the sake of the loved one that you have in prison, in jail, in hospital, in the nursing home, that is why we are trying to protect them. We're not trying to limit your visitation in any way to punish anybody or anything like that. This is just an essential thing that we need to do because many of those people are the most vulnerable with because of age and underlying health conditions and so forth. Obviously, inside the prisons, they're going to continue to feed as they normally do. They do have the options to do that in shifts so that they don't. But you know, those are things that our leaders are taking into account right now all across the state of Louisiana. So we had already made those decisions yesterday.
This may be a better question for Dr. Begno. Can we talk about testing? Is it being done sufficiently? Is there some things that are being done to look at the process?
You want to? Yeah,
Or a
I'm
question
on
for Dr. Alex.
I'm going to introduce Dr. Alex Beer, the head of the State Office of Public Health, and we can tag team that.
Yeah, no, I think we need to continue to ramp up our testing efforts. You've been seeing that consistently since we've had the ability to test, certainly within the state, and even before then when the CDC was testing. This morning we made an announcement really to clarify guidance for providers across the state that we believe that any individual in Louisiana who has symptoms consistent with COVID, having that fever and then a cough or shortness of breath, and who's flu negative should get a COVID-19 test. The flu test is important because, again, as you've heard us also say consistently, the flu, we're in the middle of flu season, and the flu is actually treatable. We have medications for that. The flu killed 1,500 to 1,600 people last year, so we don't want to forget that. We don't want to lose that from what we're doing right now. That being said, we know the vital heart that New Orleans plays for the state, and we know that people from around the state come and visit this city. And since we do believe we have widespread community spread, we think it's vital as well that we're testing across the state to get out ahead of this. We do not want to be on the back foot.
If I could add to that, I will tell you that we've been in constant communication with our local clinics, healthcare facilities. They are all working to get as much availability of commercial tests as exist locally. There is not a satisfactory supply of commercial tests anywhere in the country, and I think you heard the president and others talk about how that might increase in the next week, and we would all welcome that. But I know that all of our hospitals and many of our clinics are really trying to be creative in how they get access to commercially available testing.
And Alex, do you want to speak, though, to the improvements there, the rapid response?
Sure, and we can speak specifically to changes within the city of New Orleans. I mean, obviously, this is where the majority of cases are, as you heard Dr. Avegno announce earlier. And to meet the demands that the city's hospitals and healthcare providers have seen, we've started 3 to 4 times daily courier pickups of samples coming from New Orleans directly to our state lab, where people who are hospitalized are being tested. We're also running around the clock the testing machines at our state lab for those, again, most critically ill folks and people who may be the most vulnerable, the people we need to get a quick answer for. But to be clear and to underline Dr. Avegno's point, when we're talking about testing at scale across the state, That is not something that can be done purely at the state lab. We're going to need partnership and leadership, as you heard, from the commercial private labs as well.
Well, and you've been tapping into that.
Yeah, that's correct. We've seen people using private labs already, and we understand there's groups like Oshner really trying to locate additional new labs that are coming online.
Yeah, absolutely.
Foxay followed by WWO and WGNO. First of all, are you all looking at any sort of lockdown procedures or shelter-in-place containment zones at any at this point in planning ahead?
We can talk about our surge.
Yeah, I'm going to let the mayor address that because I know she's got some ideas. I don't know that anything that she's going to say is going to fit the description you just gave. The things we're contemplating doing are the things that I've announced, and those are things that we're doing, actions we're taking, based upon CDC guidance as to what we understand the facts to be right now, based upon the positive test results. Where those test results are spread around the state and concentrated in the city here with at least one cluster. These are the essential things that we think we need to do to maximize public safety and reduce the spread and the adverse consequences of this coronavirus. So when it, I'm not contemplating at the present any lockdowns, and I can't remember everything that you just said. Other than those things that I set forth in the amended proclamation that I issued today to amend the the declaration that I issued earlier this week.
Right, and one of the points I think that can be made as of no lockdowns, but as it relates to surge capacity at hospitals, we are being proactive in that regard, looking at alternative locations for such a surge. One of the locations that I've placed on the table this afternoon is the old VA hospital, for example. We will be doing walkthroughs with the state team to ensure if it's we know to make sure that it's adequately prepared for such a surge. We're also exploring the options if we have to erect a tent, for example. But we're being absolutely forward thinking, and I think that's the most important thing that you should know. Okay.
Two, one for the governor, one for the mayor. Governor, in regards to, since so many cases are concentrated here in the New Orleans area, do you find yourself directing a greater amount of state resources this way? And for the mayor, are you aware of any suspected cases here at City Hall?
Well, I mean, yes, that answer sort of speaks for itself because I'm here in New Orleans at this press conference. This is the center of gravity for the response effort now that we're in the mitigation phase of this response to coronavirus. But I am concerned about the whole state. And if you look at what has played out, not just in other parts of the United States, but around the world, these positive cases start popping up and you have community spread, and it is impossible to know with any precision where that's going to happen. That's why I said we were at an inflection point. The things that we're doing statewide because we have to do everything we can to get in front of this. So obviously we're devoting more resources here because the lion's share of the testing is coming out of New Orleans area. The lion's share of the surveillance testing, not just the persons under investigation, PUIs, I'm sorry. Not just the PUIs, but the surveillance testing and so forth. And this is where we're doing our planning for surge capacity, for example. To make sure that if we have individuals who don't have a home to go to, but they don't need to be hospitalized and they are positive, where are we going to put those individuals? And these are just some of the things that we're coordinating with the city of New Orleans, but they're things that we potentially will have to replicate everywhere around the state of Louisiana.
Yeah. And as for the city of New Orleans, we've been leaders in this regard, and based on the impacts within our city, caused me not to wait, to have to take action sooner rather than later, and we'll continue to be on that side of say, damn if you do, damn if you don't. You can be rest assured I'm going to be on that damn if I do, because we're going to do, and we've demonstrated that. As it relates to city employees, now you said City Hall, but I'm looking at all my people. right? And we have 7 of our first responders, as I reported on yesterday, that we have in quarantine. I know that one also went to be tested on yesterday because the symptoms really did require that. I have not been given the results of that particular test, but our people do remain on quarantine, meaning those 7. Members of our employees who have reported that they are sick, not necessarily symptoms of COVID-19, they have been asked to stay home, and they're doing just that. We will be implementing a work from home policy when we'll be communicating that more effectively with our employees when that time comes. But we're prepared to respond to the needs of our people, and at the end of the day, really do protect our first responders who are our first line of defense in this.
WTNO.
Dr. Regno, it is flu season. There's a lot of people who have already had the flu or had flu-like symptoms. Do those people who had those flu-like symptoms but didn't go and get checked, do they need to be concerned about their health at this point?
So I would say if you are asymptomatic right now, then you can take the usual precautions as you would for your health. You can and limit your contact with those who might be elderly or sick, but go about your daily business. At this time, there's no recommendation for testing for COVID-19 of anyone who's asymptomatic.
WWNO.
What resources are being dedicated at the state and local level to figuring this out, and how are they being allocated?
That's a pretty broad question, figuring this out. But no, but that is where we spend our time, and this is what we've been focused on, really not just yesterday or today, but we convened our I don't know when it was, weeks ago. We got together with the Department of Health and different state agencies, set up a task force. We've had multiple UCG meetings now. We're in constant communication with local partners to try to figure out what their needs are and try to anticipate what their needs are going to be. And that's where we spend our time planning and allocating resources. I was very heartened today by the press conference that we just heard that it appears that if those things come to fruition, and I do want to manage expectations, not about whether we're going to have more robust testing available. The press conference was in Washington today. Those tests are not going to be available tonight. Okay? And so I need everybody to understand that it takes time to put these things into place, and in the meantime, we're going to continue doing things as best we can with the resources we have available, which is why, for example, Dr. Bu said that we are using our relatively low throughput state lab testing for those cases that are most critical that we know if they had COVID-19, because these are seriously ill patients who are actually in the hospital. If someone potentially has COVID-19 because they are symptomatic and they are flu negative, but they are going to be treated at home, you don't need to know 6 hours from now if they have it as much as you need to know 6 hours from now that those individuals who are in the hospital have it. So those are the types of things that we're doing, and it is time consuming. It is difficult, but with the lines of communication that we have, the coordination we have, up to the CDC and other federal partners at Health and Human Services, for example, and I'm hopeful the VA and many other federal partners, but across the state and then down to local officials such as the mayor and her team. That's where we're spending our time, and we're doing the very best that we can. I will tell you, it is almost impossible to think that you can anticipate today all the ways that this coronavirus is going to manifest itself into a challenge. But we're trying very hard to anticipate the biggest challenges and the ones that require the allocation of resources now so that we can be prepared. We don't want to be coming in behind this thing. We want to get out as far in front of it as we can. And I know that that's a long and winding answer to what I thought was a relatively imprecise question, but it's the best way that I can try to articulate what it is that we're doing these days.
Yeah, and what I will say to what I do remember of your question is that, my administration, along with that of the New Orleans City Council, we were very protective of our fund balance. And we went to bat for that. My administration did, and the city council followed suit, meaning that we protected our fund balance for these types of events. But the bottom line is, make no mistake about it, this is yet another threat to our budget and our bottom line to run city government. You know, we've just coming out of the cyber attack. We've had lost revenues as it relates to Hard Rock. There are many things that we've had to deal with and address, which speaks to why I reached out at that federal level prior to the president's announcement this afternoon to ensure that, one, federal dollars would be unlocked to help us at the local level. And we're seeing that that has now happened, meaning the declaration by the president, but it will take some time for those processes and those dollars and resources to flow, kind of like what the governor mentioned. But we know that we will have a negative impact to our 2020 budget and even the projections that are tied to that budget. Make no mistake about it. But we also know that our business owners and leaders throughout the city of New Orleans will be taking a great hit as well. So we're going to be leaning heavily on these federal resources, working collaboratively with our governor, the full state of Louisiana, to ensure that we're able to meet our people where they are consistently.
Two more questions. Delin, followed by last question, Fox 8.
So you all have asked people who are symptomatic to stay home from work, to go get tested. As you know, not everyone has insurance in the state, and maybe doesn't have the savings to go, spend that at a hospital, or even make rent if they have to take time off of work. So, two questions here. First, what would you say to someone who's questioning whether they can afford to follow the directions and the requests that you're giving them? And number two, has this caused you to reflect on the adequacy of the social safety net in Louisiana and New Orleans?
So to speak to the testing, it's been really gratifying to see that the leaders in trying to obtain the commercially available tests have been some of our federally qualified health centers. And these are health centers that agree to take everyone regardless of ability to pay. And so what they have communicated to me is that LabCorp, who is one of the major organizations providing commercial tests, is waiving the test fee through, I believe it's until April, or when they are expecting that CMS will provide guidance waiving the fee for everyone. That's something that's been talked about at a federal level. So I would encourage everyone, regardless of insurance status, because certainly we are in a lot better place than other states because we have Medicaid expansion, and that provides access for many, many more people. But even those who do not have that, we encourage them to call their healthcare provider, call one of the clinics, or find a clinic and see if testing is appropriate for them, and then not to let price be a barrier.
Right, and as it relates to Governor?
Yeah, well, I did want to follow up because some of the things that came out in the president's press conference today about expanded testing and this website that Google's going to put up, where as soon as that is ready, people are going to be able to go and type in their symptoms and their questions, and they're going to be given guidance about whether they need a test, and if so, how they can have that test administered. We're some days, or I don't know what time period we are before that kicks in, but obviously that will be very helpful. In the meantime, I would point out that we have 460,000 poor people with health insurance today who didn't have it. And they've had access to primary care and preventative care, and so they actually have a physician with whom they have a relationship. And so we still have people who don't have that relationship with a provider, with a doctor, primary care doctor, and we still have some people who are uninsured, but we have the lowest percentage of people uninsured in our state's history. So that is very helpful as we try to get through this particular process.
All right, you were watching Governor John Bel Edwards update the public, and now we are just jumping from one press conference to another amid this health crisis facing the nation. This is Mike Cooper, the parish president of St. Tammany. Let's listen.
Of our various municipalities in St. Tammany Parish, representatives of our fire districts, representatives of our state legislature, District Attorney Warren Montgomery, and other elected officials and representatives of the agencies here in our community. As I've said before, this is an unprecedented event and an unprecedented situation that we're facing. And I want to emphasize that our primary concern, of course, is for the health, safety, and welfare of our citizens of St. Tammany Parish, our business owners, and those who come and visit our parish. Today, Governor Edwards signed a proclamation aimed to slow the spread of the COVID-19 in Louisiana. Among other things, his proclamation immediately halts any gathering of more than 250 people until Monday, April 13th. Closes all K-12 public schools statewide effective Monday through April 13th. These steps are necessary to protect the health and safety of the people of Louisiana from the risk of the coronavirus in our community. Secretary of State Kyle Ardoin, his request to move upcoming elections from April and May to June and July has been granted. The 22nd Judicial Court has put out an order limiting the cases that they will hear and limiting access to the courtrooms in St. Tammany and Washington parishes. In addition to adhering to the governor's proclamation, here are an additional steps that we're taking here at parish government. I have declared a state of emergency in St. Tammany to timely and effectively meet the needs of the community during the current COVID-19 outbreak. This allows our medical resources to keep up with the positive cases we are told to expect. Our parish-owned Tammany utilities have been ordered to restore water service to any resident who has been shut off, and they will refrain from shutting water off for the coming weeks until this emergency is over. In addition, the Louisiana Public Service Commissioner issued an executive order today stating that all public utilities, electric, gas, and other utilities that they have jurisdiction over are prohibited from disconnecting customers for non-payment of utility bills statewide. We are asking our recreation districts to postpone their scheduled activities for the next 4 weeks. Yes, we're all part of this community response, and we're all going to have to take ownership in this. The more prevention we do now, the slower the virus will spread, and that's what we want to accomplish. We know, without a doubt, that the coronavirus is infiltrating our communities, and in order to spread out, or slow the spread so that our hospitals and medical facilities can adequately serve our community, these are the precautions that we're taking. St. Tammany Parish will institute, effective Monday, a reduced workforce. That's St. Tammany Parish government will institute a reduced workforce for the next 4 weeks, or unless otherwise stated. Our department heads will organize their departments so that we make sure that we're still able to adequately serve the public, because that's our #1 goal. But we're setting an example that perhaps for our other large employers and employers in our parish may do the same thing. We will continue to monitor local information about this pandemic in our community and pass out that information and have it available, particularly on our website. I know you're going to have a lot of questions for some of the representatives that we have up here, but I'm going to first call on Mr. Trey Fultz, the Superintendent of St. Tammany Parish Schools. Mr. Fultz.
Good afternoon. Thank you, President Cooper. I think it was more fun sitting over here a couple days ago than it is today. But as you know, there was an executive order put out by the governor that closes all of our public schools for students starting on Monday morning. We have put the information out through all of our social media platforms that indeed we will be doing that. Some things that we're working on right now, it is really important to me that we find a way to feed students. You know, for many of our students, the best meal they get are the meals that we serve them in our cafeterias. 48% of the kids in our public schools qualify for free and reduced lunch. So it's important to me that we determine a way that we can meet that need for them, and we're working on that. We're also hoping to get some additional guidance from the Department of Education on what distance learning looks like and what those requirements might be before we make final decisions on what we will require from our teachers and other school-based employees. So up until that time, we're going to move slow and make decisions that are good for everyone involved, and at the same time being considerate of what a hardship this will be on our parents for many different reasons. So we want to be there for them and support them as well. But when we release school today, school will be closed for the next month, and we will work forward from then.
Thank you, Ms. Fultz. Mr. Montgomery?
Thank you, President Cooper, and thank you for your leadership and for the leadership of Mr. Trey Fultz. Today, my office met with members of the 22nd Judicial District and the judges, and as President Cooper mentioned, there's going to be a partial shutdown of the courthouse, and to a limited extent, our office will also be shut down. We're going to have a number of assistant district attorneys who are going to be working from their home, as many other offices are going to have their staff working remotely. Of course, everybody's doing everything they can to slow the spread of this, to diminish the effect of this virus. And we all know that although all the things we're talking about here are very, very important, at least 50% of the activity starts with the individual and starts with avoiding social contact, avoiding putting your hands on your face and your areas where you might be spread the virus, and of course, washing your hands on a regular basis at important times. If we do those three things, the majority of what we're trying to accomplish up here is going to be accomplished by the individual efforts of our citizens. So I encourage everyone to follow those guidelines. And if you have any questions, you certainly can go to the website of the 22nd JDC or to my website, damontgomery.org, and communicate with us, or to my website, that's my email address, or to my website, and get information about the courthouse and about our offices. Thank you very much.
Good afternoon. My name is Chris Kaufman, Fire Chief of St. Tammany Fire District No. 1 in Slidell. To my left, I have Kenneth Moore, Fire Chief of Fire District 4, Mandeville, Louisiana.
And you have been watching one press conference after another this afternoon, beginning at 2 p.m. with President Trump, followed by the governor, the mayor of New Orleans. Now you are watching a press conference led by Mike Cooper, the parish president in St. Tammany. Let's talk locally. Right now, according to the latest state numbers, we have 36 cases of the coronavirus, presumptive positive tests in Louisiana, 13 new since yesterday, a total of 26 in New Orleans, and that includes what health officials have described as one cluster at the Lambeth House in uptown New Orleans. We are very fortunate to have with us here in the studio Dr. Jim Diaz from the LSU School of Public Health. Thank you for joining us. When we hear cluster, a lot of people may not realize that has a very specific definition. So A, what is a cluster, medically speaking? And two, how concerned should we be given the vulnerability of that particular population in a home for elderly folks?
A cluster is more than one case of the same disease. And ordinarily we don't consider clusters that serious because they're just maybe just the same sort of disease at the same time. However, with this condition, given the fact that it's a disease that targets the elderly, and the elderly with comorbidities, say heart disease, diabetes, and other medical conditions, this is a cluster that is extremely concerning, particularly in light of the experience that happened in Washington State.
I was just going to say, and given what we saw unfold in Washington State.
That's correct.
What do you think is going on here? What should be going on here? Can we mitigate the circumstances?
Well, what we must do to mitigate the circumstances is to limit visitors and be screening staff going in and out, limit staff to essential staff at nursing homes. At Lambeth House is called a continuing care retirement community, which means it's a large operation. It has people there in independent living, in assisted living, and in skilled nursing. So people in independent living may be otherwise healthy other than being elderly. People in assisted living probably have other medical conditions, and people in the skilled nursing facility, as in Washington State, have a variety of other medical conditions in addition to being elderly. So when you have a cluster at a continuing care retirement community, which is a large facility compared to simply a nursing home, that's very serious. And we need to take immediate steps to limit exposure to the most vulnerable patients.
Let's talk a little bit about what we heard President Trump say earlier. To sum it up, he declared a national emergency, freeing up $50 billion to help fight the coronavirus. He has instructed every state to activate its emergency operations center, and he instructed every single hospital in the country to enact its emergency preparedness plan. Essentially vowing to cut through the red tape to get people tested who need to be tested. Is, in your estimation, was that an adequate response?
Yes, I think we need to go to that response, but we're still not to the point where we can test everybody who needs to be tested and give them an answer right away. What we need to do, we discussed pushing the curve down, the epidemic curve down, and that's very important so we don't overwhelm healthcare professionals in hospitals, because remember, if they're taking care of a patient who now has progressed from an asymptomatic condition to symptomatic pneumonia or respiratory failure, that patient is going to have to be moved to the ICU, put on a breathing machine. That's going to take a lot of doctors and nurses round the clock working 24 hours to take care of that patient. So hospitals may have to limit other services, including elective surgery and other services.
I was talking to a doctor out of state up in the Northeast earlier who said, listen, you got to remember that in America, we're at 96% capacity on average anyway. And I think we all have probably anecdotal experiences where you go to the ER and you have to wait, a long time to get a room because there just aren't enough beds.
That's correct.
So when we're talking about flattening the curve, let's talk about the importance of doing that and what it means so that we can actually expect to be treated if in fact we get sick.
That's correct. Every disease outbreak, infectious disease outbreak, has what we call an epidemic curve. And we can use the one in China as a quick example. China had an epidemic curve that began in December, and it ramped up very rapidly to over 80,000 cases. And now it's on the downslope of that curve. China is now reporting less than 100, actually less than 50 cases a day. So it means they're on the downslope, but it took them almost 4 months to get there. So that is a time period. And what we need to do is reduce the peak of that curve. It even overwhelmed China. China had to build hospitals, additional hospitals to serve the patient. So by reducing the peak of the curve, and we do that by testing, by knowing who could be communicable because they have a positive test, by isolating those patients, and if we reduce community spread, we can flatten the peak of that curve. And the importance of that is, if we flatten the peak of the curve, we send fewer patients who could have more severe disease to hospitals.
And let's talk about really, working as a team here as a community. And you heard the governor say we need to be good neighbors. He said we need to be good citizens. And to put it into perspective, we're asking people to make sacrifices, especially single income families for whom it will be very difficult to provide childcare now that the schools have been closed. as I understand this, it's not that the kids are, are susceptible to this. They're likely not. But they could bring it, they could be the unwitting carriers.
That's right.
And transmit it to the vulnerable population. And I've never in my lifetime heard officials take such a stance on this to protect a pretty large segment of our community.
That's right. Children are relatively resistant, probably for many reasons. One is they're just experiencing one cold after another. And we know that the alpha coronaviruses, which are not that serious, cause about 30% of common colds. So kids are experiencing alpha coronavirus cold infections all the time. And that gives them a certain amount of antibody protection against the beta coronaviruses, of which this novel coronavirus is one. So they have a certain amount of protection. However, they can still pick up novel COVID-19 virus, and they could potentially transmit it to grandparents or to others who might be immunosuppressed.
Right, or to their friends, exactly. And you say immunosuppressed, perhaps it's not their family that they could put at risk, but a friend's family, who might be taking care of a cancer patient or a dialysis patient or an elderly person, just a grandparent.
That's correct. And what we haven't discussed so far is that we have to remember that the first case in the United States was a 35-year-old man, healthy man, who just returned home from Wuhan, China. He didn't go to the wet market. He didn't have any contact with sick people. Fortunately, he reported right away to a medical facility. They recognized that he needed to be isolated. He was treated and recovered. But he was 35 years old. He wasn't 65 or 85 years old. So we have to remember that even young and otherwise healthy people who may be immunosuppressed by virtue of diseases that they have or drugs that they may be taking. For example, you may be a young person with diabetes. You may be someone with ulcerative colitis or inflammatory bowel disease and on one of these biologics like Humira. Or you may have psoriasis and be on another biologic. These drugs could actually immunosuppress you and put you at risk, even though you're not elderly.
And we're certainly not trying to ramp up the fear. There's enough of that out there.
That's right.
But I think it is imperative that we make people understand why our officials might be asking us to make tremendous sacrifices at this time.
Right. And what they're trying to do is they're trying to get us to flatten that curve so we can preserve the healthcare facility and the personnel we have working in healthcare so that they are capable of taking care of the most seriously ill people. So if most 8 or 9 patients out of 10 can be isolated at home after their positive test, and they'll be perfectly all right. I mean, Tom Hanks and his wife are being isolated in Australia.
They're doing their part.
That's right, they're doing their part. Tom Hanks also has diabetes, so he's going to have to be monitored quite carefully.
Okay. We heard that the president say they are working in tandem with Google and all sorts of members of the private sector, Walgreens and Target, et cetera, that by Sunday night they hope to have a website up on which you can type your symptoms and it will tell you whether or not you should be tested. And then you could go, it will, according to them, direct you to a drive-by testing location and then give you the results much faster. Do you think it's possible, given where we are today, Friday evening at 4:30, that this will be up and running by Sunday? And then just talk to us about how long it just takes to get test results in the best case scenario.
Well, hopefully the website will be up and it will tell you if you need to be tested. Whether or not private industry can respond with the number of tests, everybody's going to want to be tested. Ultimately, Colorado is already using a proprietary commercial test, and I saw on TV today lines of cars driving through parking lots to get tested, and we're going to have to go that route. People are going to have to drive in to their Walmart parking lot or a CVS or Walgreens, and one of the pharmacists who work at these facilities will actually come out and take the commercial test. But that's going to be time involved, because to do a test, you're going to have several vials, 4 or more vials, and into those vials you're going to have to put Q-tips, essentially swabs that come from the nasopharynx, so back in the nose and back in the throat, and they're going to have to be taken by a technician, gloved, gowned, wearing a mask, and they're going to take that sample from you, put that in those vials, and they're going to probably collect a large number of vials, and then a van from Quest or LabCorp or Roche is going to come by and pick up all of those samples, possibly at the end of the day, or it would be nice to have it throughout the day, and then they're going to have to bring it to one of their laboratory facilities. Fortunately, these commercial companies have many laboratory facilities scattered all over the United States, and they're not like CDC.
And they're working around the clock, so then theoretically you would expect a spike in the numbers.
That's correct. The more tests we do and the more rapidly we get the test results, then we're going to see a quick ramp up in the number of cases.
So that is not necessarily a reason to be alarmed. And you know, I'm looking at us here on the 2-shot, and looking at us, you know, on a wide shot, and we're letting people know that we've actually moved. You know, we've kind of changed our behaviors here too. So we've got 6 feet in between us as we communicate now.
Right.
It was on purpose that we are doing this. You were with us Monday. It is an entirely different world in which we live now. Just 5 days later.
Right. Every day changes.
I was thinking about something you said when we were off camera, and that was the blood of people who have survived coronavirus and done very well will be valuable. Tell us why.
That's right. Because that means that they will be developing immunoglobulins, which is a fancy word for antibodies, against the disease.
From which we could derive perhaps a treatment?
Well, we could. It will help us to decide what part of the virus, which we're now growing in laboratories, we need to stimulate an immune response and not give somebody the disease. So we're already working on developing a vaccine based on what happens when people and animals, experimental animals like rodents, are exposed to the virus. So this has given us a head start. Now, we don't usually do this, but it has been done in other countries. If necessary, you can actually take someone's blood, plasmapheresis it, because we know it has antibodies in it, and give it to somebody who has significant disease. And we use that. We've used that before to treat rabies. We've used it to treat a number of other infectious diseases.
That's really encouraging, actually. And again,
Yes.
anytime we're armed with information that could allay fear, I always feel empowered by that. Given what you're saying, then, could you retroactively test somebody a doctor believed to have been positive and has now weathered the storm?
Absolutely.
And then perhaps look at their blood too, because then it would
Sure.
have the antibodies.
That's correct.
Right. Okay. Gotcha. That's good to know. Let us also talk about. Actually, in 2 hours, we're expecting the president to release some more information, so we'll have to see what they say. But when you hear Dr. Fauci talking about flattening the curve, and you were talking about that, he also threw out other terms that people may not be familiar with. That is containment versus mitigation.
Right.
What stage are we in? What's the difference?
Well, we're actually still in a containment stage. And
Which is
containment,
good, right?
Containment is self-isolation, quarantine,
Right.
closing schools.
Like almost putting a perimeter
That's
around,
correct.
hopefully, around the
Like
disease?
New Rochelle, New York, that's containment. And mitigation is actually going out and testing and treating. And so
When it's
that's
out there.
mitigation. Right.
Okay. Let's put this into perspective. You've been doing this for a while. Have you ever seen anything like this before in your career?
We haven't seen it here, but the same thing happened with a close relative of this novel coronavirus, and that was called the SARS virus. So SARS is severe acute respiratory syndrome, and it was the first coronavirus to cause an epidemic, but it was a limited epidemic. It also began in southeastern China. It spread worldwide. It came to Vancouver, Toronto, Canada. It hit Canada very hard. It didn't hit the United States as hard as it hit other countries. But this was similar in other locales and not ours. I've never seen something like that. That's
yes,
right.
Almost a microcosm.
That's right.
You bring up China. When the president was talking about working with the Chinese officials, in particular the pharmaceutical companies working closely with the Chinese researchers, you were nodding your head during that press conference. Actually, we're going to get your thoughts on that in a moment. Cynthia Lee Shang is now holding a press conference in Jefferson Parish. Let's take that. You want them up?
Good afternoon. I have with me our council members, our chairman, Councilman Ricky Templet, Councilman Marion Edwards, Councilman Scott Walker, Councilwoman Jennifer Van Rankin, and Councilman Dino Bonanno, as well as Dr. Cade Brumley, who is the superintendent of our school systems, Dr. Jerry Satanovich, Joe Valiente, who is the director of our emergency operations, as well as our deputy and chief operating officers here today. Did I miss anybody? Okay. Today, Governor John Bel Edwards signed a proclamation that halts any gathering of more than 250 people until Monday, April 13th. This proclamation also closed all kindergarten through 12th grade public schools statewide until Monday, April 13th. At this moment, we have 36 presumptive positive cases related to non-travel. And the difference there is that as these cases started coming down, we realized that they were community transmission, which is the reason why we have very aggressive measures that you're going to see in our parish and at the state. Testing will become more available, and as testing becomes more available, we should have every expectation to see these counts rise. As we know, 80 to 85% of these cases are mild, and that will require no medical attention, not necessary to go to your doctor, not necessary to be hospitalized. But 15 to 20% of these cases can be quite severe, and of those cases, our most vulnerable populations is the elderly and those with underlying chronic diseases. So the theory is about flattening the curve, that when you study this across countries, when you study this at the cities in the United States, you expect to see a very large peak of cases. And if you can reduce that peak and lower that peak and flatten that curve out, your limited medical resources, your limited hospital beds, the staffing is able to keep up with the demand, and that we're able to truly have hospital beds, nursing staff, doctors to our sickest patients. So the key is to lengthen this virus coming into our community and lower the peak. And if you can do that at the front end very aggressively, you are able to minimize certainly the critical cases in our community. And that is what you see us doing along with these proclamations to flatten the curve and slow the spread. So again, we are in the mitigation phase. As a parish government, we believe that it is very critical, now more than ever, that our critical government services continue as much as possible. Our water department, our road department, those things of that nature that the community relies on us to provide consistently, no matter what the situation. So that's why we are taking proactive measures to limit the amount of public activities and essentially limit the amount of unnecessary public activity that our employees will have to endure. We certainly don't want key managers getting sick, and then we have to quarantine them. So as we are now, this is the reason for these measures. All Jefferson Parish permitted social activities, regardless of size, are suspended until further notice. All Jefferson Parish Recreational Department activities will also be suspended until further notice. All non-essential and social senior activities in Jefferson Parish are suspended until further notice. However, the essential activities of Jefferson Parish will continue, including food distribution service. David, can you, that's in my my own phone, sorry, I'm disturbing myself. And all non-essential activities at Jefferson Parish facilities will be canceled and postponed until further notice. So programs at our Jefferson Parish libraries, our Jefferson Parish animal shelters, Ilario Center, our Performing Arts Society. All non-essential programming at Jefferson Parish community centers, senior centers, Head Start centers are suspended until further notice. And note that essential services, including food distribution, as I said, will continue. And there will be limited public access to our Jefferson government facilities. We are open. Our departments are open. Many of our departments that have the suspended programming activities will be reassigned to help other departments, but we want to limit the public interaction that we have. So again, we are not closing, we are opening, but behind the scenes, our staff, we will be reassigning people. We will be looking at flex time. We will be looking at operating in larger facilities so we can engage in those social distancing practices that we know are very critical. Our Jefferson Parish Transit Department will continue service and is working alongside TransDev and health and security officials, as well as industry leaders for updates and best practices regarding the coronavirus. So that includes daily cleaning of all of our buses and our transit vehicles. And again, we want to remind people that the best way we as a community, and I do see this as every citizen's obligation to participate in these methods, is to stay home if you are sick. It's to engage in those personal behaviors to limit and minimize the spread of this disease. Covering your cough, not touching your face, again, staying home when you are sick, the social distancing measures that we need, wiping down frequently touched surfaces, and ensuring that those materials are used to the fullest extent possible. So when you have that Clorox wipe it until it's dry. Wipe it against all of your doorknobs, all of your handles, all of your surfaces. Make sure you lengthen the use of those things. We are still living life in this community. Of course, our restaurants are open, our shopping malls are open, our grocery stores are open. But life is just going to be altered somewhat with these large gatherings and with unnecessary social gatherings for the next few weeks to get ahead of this, like we can see so many communities did not. And it's very clear that the countries and the communities that were very aggressive at the forefront had better results at the end of the day with this virus. I have here Dr. Cade Brumley is here, and I would like to invite him up because I know they were major changes today with our school system, and I want to assure everyone I have been in communication with our school officials. I have been in communication with our local health care providers, all of our major systems, our mayors. So the best way we can combat this is a lot of coordination between all of the sectors of our community. I was in touch with our chamber, our Jefferson Business Council, JEDCO. Every sector of our community working together on this is the best way we as a community are going to be able to get through this with the minimal amount of severe cases and letting our medical personnel last as long as possible to as many people as possible. We are going to look at creative ways. I have already reached out to some of our hospitals that were concerned about health care. We have facilities if they need to use that, if we need to be creative. And I know Dr. Brumley and I have talked many times about creative government and helping one another and pivoting and turning those facilities to other uses that we need in this community. All the different things that might need to happen, we probably haven't even had a chance to think of yet. Our council's already been discussing a lot on the measures that they need to take in ensuring that there's as much public access to their votes, but also as minimal public interaction as possible. So all of us have been working behind the scenes to really come together as a community. And I would like to invite Dr. Brumley up because there was so many things happening at the school today.
Thanks, President Lee Sheen. You've done an outstanding job coordinating efforts across the parish so far. So in terms of the public school system, largest school system in the state of Louisiana with almost 51,000 kids, we decided very early on to try and take a lead in this effort to prevent the spread of coronavirus, not only through our school but through the community. We were very pleased with the steady efforts that we took through this process, trying to keep our doors open as long as possible because we know that families depend on us to be open every day. Specifically, we also know that hospital officials, medical care providers, they need to be at work every day. And so in order to be at work, their kids need to be at school. We also knew that if we close the doors to our schools, oftentimes when school is out of session, parents often send their kids to grandpa and grandma, and that's exactly where we did not want them to send their kids. And so we worked for some time to keep the doors open, always realizing it's an evolving situation, and at any point we could have to make a shift or a change. And so when the governor made the declaration today, we know that he did not take that lightly. We know that he had good sound advice to make those decisions, and we fully support that decision. At this point moving forward, I think what's most important for us is that we go into our schools and provide additional sanitation efforts in those buildings. Also knowing that some of our most vulnerable students will still need meals during the day. So we're working right now to determine how we might best provide meals to our students while they're not physically at our space. That will most likely be a grab-and-go type option once we get those logistics more fully defined. We're also very concerned about student learning during this period of time, and so we will open a suite of options online for our students to participate in, but we recognize that only about 50% of our student body have access to internet or technological devices at their home, so we recognize we'll have to have a paper-based component of that as well. We are developing that. We've been working on that for some time, and we hope to go live with that probably within the next week to support our families. One of the things that I'll be asking my board to do tonight at a 6 p.m. special session is to declare a state of emergency for the school system as well, which will give me a little more flexibility over the next month to make needed decisions in the best interest of the parish. Also, we're very concerned at this point with ensuring that individuals that provide medical care will have child care, individuals in law enforcement, individuals in emergency personnel roles across the board. So we're thinking through ideas at this point on how we can support child care for essential roles within our community.
And we have Dr. Jerry Satanovich here. I know you were on a lot of conference calls today, so if you would like to share some of that information.
Sure. Yeah, first, as a healthcare professional, I'd like to say how pleased I am with the seriousness that all levels of government are taking this crisis. Before I came here this afternoon, I was at one of the 3 Ochsner locations at the urgent cares that are doing testing for COVID-19. And based on my experience here this afternoon, I want to make a point to everybody in the community. If you think you've been exposed and have a question that you need to be tested, please, if you can, do not just show up at either a doctor's office or at one of these centers. The centers are overrun. And what's unbelievably frustrating for the community and for our staff is for somebody to be there, wait hours, to go in and think they get tested, get interviewed, and find out that they don't meet the criteria at this point. So I strongly recommend a call to your provider or a telemedicine visit if you think that you're affected.
As Dr. Satanovich said, we want to support our medical providers as much as possible. They are on the front line of this. In a lot of the conversations we had yesterday, requesting a test, you just can't go to your doctor and request a test. So first of all, if you start developing symptoms, please call your doctor ahead of time. So they're prepared for your visit. They can protect their staff. They can bring you in a back room. You're not coming into the patient waiting room. Also, before you have symptoms, and even if you are positive for this virus and you don't have symptoms yet and you are tested, it's a lot of false negatives coming up there. So it's a false sense of security to try to get tested before you have symptoms because the test will not reveal itself until a little bit of time. So asymptomatic, requesting a test, you cannot rely on that result. So I'm happy to open it up to any questions that you may have. Anything? Yes.
Are you aware of any private schools that are going to be remaining open in Jefferson Parish?
So I know the Archdiocese, what is the latest in the Archdiocese? They closed, I don't know the date. And again, this is how quickly this information is coming. I mean, Joe Valiente, who is the head of our emergency operations centers, this is like 5 cat storms coming at us in multiple times. The nature of the information that is and hour by hour changing is so critical that, so we do know that the Archdiocese is closing as well, and then independent schools certainly will be closing as well. Okay? Yes.
What about public school teachers? Are they coming to work?
So immediately, teachers will not be coming to work because we need time to go into the facilities and provide proper sanitation. Once we get Once we get past that, we will be building a schedule, or we will be building a schedule to bring staff back into the facility. That will be important because, as I said, we'll be delivering both online and paper-based instruction to students as we move forward. One of the reasons I'm calling the special session of our board tonight is to get our board to authorize pay for our employees as we move through this process. And so we feel really good about still being able to do that for our employees.
What can you tell us about like the Ilario Center, LSCD?
Essentially, the decision we're making in the parish is any non-essential activity where we are bringing people together, we're not going to do. We're not going to take on the extra risk. I'll have employees there that don't need to be with the public that I'm exposing. They come back to the government building. So it really is just that one question. Do we need to gather these people together? Our concern is making sure the essential staff, the water supervisors and those people in public works and those people who are providing services to our most vulnerable people remain healthy and unexposed to this virus. So anything that is not needed to be done, we do not want them gathering in a public building. And that is essentially the crux of our decision making. Yes.
The City Council plan to continue to meet throughout this process, or will y'all be working remotely, or?
We're still waiting to determine what the council meetings. We have a few weeks before our next council meeting, so we're waiting to determine that.
Certainly, they will all have, discussions about when you have a council meeting, you're bringing everybody together in the chamber. And again, these were the nature of the discussions that the council members were having this morning. And, they're trying to balance making sure that everybody has a say-so in the vote that they're taking, but not bringing those people together. So you will be seeing very creative things coming from our council members, using perhaps video conferencing for some of their group gatherings. They really want to keep their public informed, their constituents informed, but also fall in line with these measures that the governor and the president want us to do. So we have not figured out all of the different ways that you will see government service in the next couple weeks, but I assure you we are all working closely together, because I do believe the coordination that we have throughout our community on all the sectors, the government sector, the private sector, the medical sector, our educational sector, working together and talking helps us as a community. And that's why I've personally spent so much of my time since Monday speaking with Dr. Brumley, speaking with the head of the head of schools for the Archdiocese, speaking directly with Ochsner and LCMC and East Jefferson General Hospital, because I believe that is putting our best foot forward on this. Any other questions? Okay, we commit to keeping you updated on anything that we know, and we certainly appreciate you helping us get this message out so that we don't have patrons and our citizens coming to our government facilities for programs that we have suspended. So thank you so much.
All right, and that is the latest in a long line of press conferences we've had today. Cynthia Lee Shang from Jefferson Parish. We've got Dr. Jim Diaz with us in studio from the LSU School of Public Health. Let's just talk about practicalities now. So the schools are closed until April 13th. Should parents allow their kids to go to play dates, or does that defeat the purpose?
Well, they're going to have a hard time keeping kids from going outside and playing together with neighboring kids. The real issue is grandparents at home, grandparents as caretakers, grandparents who may be elderly or have other diseases. So it may be necessary to practice a certain amount of social distancing in homes, and cleaning of surfaces in homes as we get kids at home and insular families increasing.
So should people ask their parents to help them, or should they really exhaust another list before they go to their parents who are more at risk before they ask them to help take care of their own children?
Well, I certainly think that elderly grandparents who have other diseases are at higher risk. COPD, heart disease,
diabetes, hypertension?
Certainly diabetes, cancer, on chemotherapeutic drugs. They should not be primary caretakers, and they should have their own private rooms and practice a certain amount of social distancing. And families, with kids who are out and about playing with other kids, they should practice on cleaning surfaces, periodically washing hands, encourage washing hands among kids.
We just did a story yesterday on how long the germs can stay alive on various surfaces.
Yes.
You're telling me they've got new information now from Germany. What
Yes.
is the latest now?
The latest is the virus can remain on surfaces communicable for up to 9 hours.
On a multitude of different surfaces.
Yes, on doorknobs, on flat surfaces, and these need to be wiped down with a solution, say, of Clorox, which is about 0.1% sodium hypochlorite, or a solution of 60 to 70% alcohol. And you can make your own.
And I had someone ask this, I think it was in the newsroom, you know, if we're wiping things down with bleach and such, do we need to open up our windows?
Well, certainly, yeah. If you're using a lot of bleach, and don't ever mix different cleansers, because you can create noxious gases that way.
I almost blew my house up doing that one time,
Yes.
a long time ago.
I mean,
That was
you don't want to
remarkable.
mix a toilet bowl cleaner and Clorox, because you can create chlorine gas. That's one of the reasons why we won't let you bring bottles on airplanes.
That makes sense, and that makes
Yes.
sense. You know, we were talking a lot about being good citizens, and we're hearing about a new citizen here to New Orleans, Zion Williamson. Take a listen to this. He just posted on Instagram that he is going to cover all of the salaries for all of those Smoothie King Center employees for 30 days. And he says it's because his mother always set an example for me about being respectful for others and being grateful for what we have. This is an incredibly resilient city full of some resilient people, but sometimes providing a little extra assistance can make things a little easier for the community. So bravo to Zion Williamson, such a generous member of our community already, taking care of those who are vulnerable by virtue of just their employment right now, right? They closed down the Smoothie King Center. Right. That affects so many people with their jobs.
That's a wonderful thing. I wish more CEOs would do that.
And let's talk a little bit about, again, this community effort, because we keep hearing from parents saying this is just, it's so much for me to bear. And our hearts go out to them, but how incredibly toxic, potentially deadly this disease could be to a big segment of our population, and what we need to do, the younger, healthier people, to protect them.
That's correct. And we just need to recognize those at greatest risk, the elderly, especially the elderly with underlying diseases. And even within the household, we need to provide protection for them by distancing and also by cleaning surfaces and frequent hand washing. And hand washing is better than using alcohol-containing solutions, so frequent hand washing. And you know, kids are getting better and better. We need to teach them frequent hand washing techniques and washing your hands for 20 seconds.
And you were saying you may be drafted to help take care of your own grandchildren. When we talk about children, you know, at first I think some kids were maybe welcoming the idea of being off from school, thinking of it as a vacation, but I definitely sense some fear among the children. So how will you explain this to your kids? How should we as parents be explaining it to our younger children?
Well, you should be totally honest with them, and they're pretty sophisticated because they're watching TV all the time.
Right.
And
so how do you say it though, with making them make sure they wash their hands, but that they don't go to bed fearful?
Well, you have to tell them that it's an important thing to do no matter what, as well as protecting your cough and practicing a certain amount of this social etiquette where you either cough or sneeze into a tissue and then you dispose of that and wash your hands. Right. Or if you don't have a tissue immediately available, you don't sneeze or cough into the atmosphere because those droplets can go out 6 or more feet. So you teach them how to cough or sneeze into the crook of their elbow, and it's probably not a good idea to teach them to do elbow bumps with everybody because people are actually contaminating their coat sleeves.
Are we going to the extreme when we hear the people on the network news saying come home and kind of take your clothes off and just throw them in the washing machine just to be safe, or is that maybe a good recommendation?
Well, certainly if you're a healthcare worker or you're a screening, you know, you're a pharmacist and you're working, you know, in the parking lot at Walgreens and you're screening one person after another at high risk, or a person who may have symptomatology like sore throat and fever, well then, yes, you ought to do that.
And why not? Just do it as a precaution.
But ordinarily, that might be a little bit extreme.
All right, Dr. Jim Diaz, thank you so much for your time and sharing your expertise. And you know, we don't know how long this is going to go on, but I was just thinking back 5 days ago when you joined us with our first case. We're up to now 36 cases. We know that number will spike after we get the numbers with more proficient testing. So we thank you so much for joining us, and we'll probably tap you for some more information as we move forward with this. Thank you.
Okay, thank you.
And we're going to have a quick break, then go to our regularly programmed our regularly programmed Eyewitness News at 5.
This has been breaking news from Channel 4's Eyewitness News. For the latest update,
You're going to do real well.
We get a lot of calls from injured people, but we also get a lot of calls from other injury attorneys asking for advice. When you're hurt in a wreck, call the attorneys that the other attorneys call for help. Call Mike Brandner, injury attorney.
Call 345-1111. Now handling jewel cases.
Negotiate your salary. You're worth every penny.
You're never too old to get the band back together.
1, 2, 3.
At Regions, we think there's only one way to manage your money. Your way. And our award-winning service can help you find it.
Save your allowance. Growing up gets expensive.
Switch for good. Regions has the people, tools, and tech to move you forward.
Get ready to save at Toyota's Ready, Set, Go event going on now at lakesidetoyota.com.
Hundreds of new Toyotas, used cars, and certified Toyotas are ready to go with our lowest upfront price. Go to Lakeside Toyota and get 0 APR on new Toyotas. Truck buyers, drive 2020 Tacomas for just $99 a month. Or pocket $2,500 customer cash. Get a $5,000 rebate on 2020 Tundras. Or get 0 APR for 72 months.
Serving you for nearly 30 years at the foot of the causeway, Lakeside Toyota.
It's the big deal at Hurwitz Mints. 40 to 60% off store-wide. An extra 10% off your purchase. Plus no interest for 2 years. It all adds up to the big deal. Now through Monday, only at Hurwitz Mints.
When I was in foster care, I never knew when I would have to move. So I always had my suitcase ready to go. Then one day, I was adopted. My new parents opened their hearts and home to me. My parents cook my favorite breakfast for me every morning. My parents take me on trips I never thought I would go on. They gave me a home and an even better reason to use that suitcase. My parents aren't perfect, but they're perfect for me.
Live from WWL-TV, this is the Eyewitness News at 5.
We are constantly getting new updates on the coronavirus situation, and we want to bring them to you as soon as we get them. Good evening, everyone. I'm Katie Moore.
And I'm Karen Swenson. President Trump has officially declared a national emergency, and that opens up access to federal money and resources to fight the coronavirus. We just received new numbers from the state health department. Here in Louisiana, there are now 36 presumptive positive cases, 3 new ones in Orleans Parish.
And in order to stop the spread of the coronavirus, there were some major announcements today impacting all of us, quite frankly. Governor John Bel Edwards signed a proclamation that halts any gathering of more than 250 people until April 13th. That's about a month. All public schools and the Archdiocese of New Orleans schools, kindergarten through 12th grade, will be closed effective Monday, March 16th. And they will not resume until Monday, April 13th. New Orleans Archbishop Gregory Amond also announced today that he's dispensing all Catholics from the obligation to attend Mass on Sundays through the next 30 days. In the meantime, President Trump's emergency declaration opens up a lot of new doors for treating the coronavirus.
To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency. 2 very big words. The action I am taking will open up access to up to $50 billion of very important and a large amount of money for states and territories and localities in our shared fight against this disease. In furtherance of the order, I'm urging every state to set up emergency operation centers effective immediately.
And with New Orleans having the most cases of presumptive positive coronavirus, Governor John Bel Edwards and New Orleans Mayor LaToya Cantrell held a joint news conference this afternoon with an update. And Mike McDaniel joins us live with more on what they had to say. Mike?
Hey there, yeah, we're going to talk about specifically New Orleans and what the mayor had to say when it comes to city buildings, city agencies, and even public meetings, because there will be some changes there. The mayor is stressing tonight that the city will not be shutting down government-wise, and it will be business as usual. But come Monday, there will be some restricted access to those public buildings and those agencies. Here at City Hall, that means no more than 50 people at one time inside the building. City council meetings as well as committee meetings, those have all been suspended until the end of March, and that could be reevaluated and extended if needed. Now, when it comes to employees, now the mayor says 7 first responders are currently in quarantine when it comes to this virus. One of them had to take a test yesterday because they were displaying some type of symptoms related to coronavirus, but the results, the mayor says, have not come back. Employees who are impacted by this will be put on civil leave, which is a form of paid leave here in the city. And any employee who is displaying symptoms or feels sick is currently being asked to stay home. So take a listen to what the mayor said a little earlier.
City Hall is not closing, but again, we're making efforts to limit contact and reduce large groups. This also speaks for our employees, in which we will be communicating directly to employees of city government.
And the mayor says a thorough cleaning will be done at city buildings, and that will be the process moving forward. You just heard her talking about curbing or mitigating efforts to reduce large numbers of people. Well, the police department here in New Orleans is asking folks not to gather in large numbers, and the mayor says the enforcement of that will be complaint-driven. Live from City Hall in New Orleans, Mike McDaniel, Eyewitness News.
Good information. Thank you so much, Mike. Now to 2 of the questions that I think are making people the most concerned. How do you know if you should be tested for the coronavirus? And where do you go? Medical reporter Meg Ferris is joining us with the new information on all of that. Meg?
Well, Katie, Medical Watch first reported early this week that doctors believe they were sending people home who they thought should be tested for coronavirus. That's because the rules from the CDC were too specific. Well, now there are changes with testing. Concerning calls and emails from you are coming to our newsroom. Quote, "I've been sick for over a week," writes one viewer. "I had every symptom of the coronavirus, but since I myself didn't travel out of the country or no one I've had contact with directly went out of the country, no one even thought to test me because I don't meet the criteria. I'm very scared that I've been transmitting this virus. I want to know if I have it so I don't accidentally spread it to someone who won't be fine if they contract it." First, today the State Department of Health recommends COVID-19 testing for any patient with fever, respiratory symptoms, and a negative influenza test. Next, the Uptown Senior Living community of Lambeth House is now testing on-site for those with symptoms in the independent living area. So far, 9 residents tested positive for the virus. Now, infectious disease expert Dr. Bropson Lute says doctors need to use the sterile all-plastic, not wooden swab, and do a nasal pharyngeal swab, or you could get a false negative.
And that means the swab goes through your nose to tickle the back of your throat. It's a different kind of culture than most people are used to.
It can be sent to one of the commercial labs or pharmacies. And Dr. Lute says Mardi Gras may have been where people contracted the virus. He recently talked to an ER doctor.
She saw a tremendous number of people come in with influenza negative respiratory tract symptoms. And of course, that was before the test was even available in Louisiana.
And Dr. Lute says, in his opinion, at this point in time, he does not think quarantine is going to slow down disease in our community. Dr. Diaz just told me the same thing. Also, some people who have no symptoms of being sick yet, but have the virus, will test negative until the virus multiplies to a big enough number.
All right, Meg, thank you. St. Tammany has several presumptive positive cases of coronavirus now, and Parish President Mike Cooper held a news conference a short time ago as well. David Hammer was there, joins us live with an update. David.
Hey, Karen. Yeah, there were 2 presumptive cases actually from St. Tammany Parish residents. There was an additional case that was here in St. Tammany that was apparently an Orleans resident, but officially 2 St. Tammany Parish residents who have presumptive COVID-19 cases. And Mike Cooper, the parish president, was here with 25 local political folks, members of the mayors of various cities, and folks from the St. Tammany Parish Sheriff's Office and other local authorities, and they said that the local hospitals are ready and prepared for treating patients. The biggest concern now, though, is how to deal with seniors and students. There are 7 senior centers here in St. Tammany Parish, and the Council on Aging, Julie Egan, said they're trying to figure out a way to deliver meals to some of those senior members of the community who use those senior centers, because the senior centers will be closed until April 13th. Also, St. Tammany School Superintendent Trey Folse said that his priority was serving the approximately 20,000 K-12 students who use free and reduced lunches at school.
We're going to have cafeterias ready to feed students. Both, we will do a lunch and a breakfast for the next day at the same time. Will it be Monday? No. It will be right after that. We will be putting out the word for that, trying to get everything in place for that. You have to remember, we learned just like everyone else a couple hours ago that this was going to happen. So we've been certainly planning for that, but we want to do it the right way so that everyone can be served, and the plan would be that they would pick up lunch and the next day's breakfast at the same time, and they would be to-go type situations.
And as you can hear from Folse there, they were scrambling because they were planning on making an announcement, and then we heard from Governor Edwards that there would be closure of all public schools through April. And by the way, they are going to have to cancel because of the limit on 250 people gathering in one place that the governor announced. They will have to cancel tonight the proms for Lakeshore High School and North Shore High School. Reporting now from St. Tammany Parish Government Offices in Mandeville, David Hammer, Eyewitness News.
That's devastating for those students, but necessary. Thank you, David. Jefferson Parish President Cynthia Lee Sheng held a news conference to update residents on Jefferson Parish and the preparations that they're taking for coronavirus. She says it's critical that government services continue.
Our water department, our road department, those things of that nature that the community relies on us to provide consistently, no matter what the situation. So that's why we are taking proactive measures to limit the amount of public activities and essentially limit the amount of unnecessary public activity that our employees will have to endure.
And St. Bernard Parish has a presumptive positive case as well. Parish President Guy McGinnis also just wrapped up a news conference. Here's what he had to say about the precautions being taken there.
St. Bernard Parish government has declared a state of emergency so that we can plug into state and federal funds if they become available. All government-run public services will continue as normal for the citizens of St. Bernard Parish, with the exception of all recreation activities have been suspended immediately. All events throughout our parish that include over 250 people, including this Frederick Segure Civic Center, our Crawfish Festival.
The Louisiana presidential primary also postponed. That was scheduled for April 4th. The new date is Saturday, June 20th. Secretary of State Kyle Ardoin says that a lot of the poll workers are elderly, and he hoped that to avoid putting them at risk during what could be the height of the coronavirus cases in the state.
Also, French Quarter Fest, it is postponed. It was originally scheduled to begin on April 16th, but now it's planned to be held October 1st through 4th.
And we found out this afternoon that NCIS New Orleans is stopping production. One of the actors, Rob Kirkovich, posted this on his Instagram, saying they were told last night they were shutting down for the rest of the season.
Still ahead on the Eyewitness News at 5, as cancellations and closures continue, a lot of you apparently are stocking up.
And a lot of people are here stocking up at the store. We'll have a look at what they're buying and why.
And for a change of pace, high temperatures got into the low to mid 80s during the day today. What about this weekend? Details coming up.
The Rooms to Go Kids Anniversary Sale is on. Bring home this cool bedroom set for just $9.55 or $16 a month interest-free with twin sleigh bed, dresser, and mirror. Just move your feet to the Rooms to Go Kids Anniversary Sale.
Hello, Winn-Dixie. You can feel the savings. Let's shop. Buy one, get one. That means one is free. Win, win. It's a win-win.
Winn-Dixie. It's a win-win. Once weekly Ozempic is helping many people with type 2 diabetes like James lower their blood sugar. A majority of adults who took Ozempic reached an A1C under 7 and maintained it.
Here's your A1C.
Oh, my A1C is under 7.
And you may lose weight. Adults who took Ozempic lost on average up to 12 pounds.
I lost almost 12 pounds.
Oh.
For those also with known heart disease, Ozempic lowers the risk of major cardiovascular events such as heart attack, stroke, or death.
It lowers the risk.
Oh.
And I only have to take it once a week.
Oh.
Ozempic is not for people with type 1 diabetes or diabetic ketoacidosis. Do not share needles or pens. Don't reuse needles. Do not take Ozempic if you have a personal or family history of medullary thyroid cancer, multiple endocrine neoplasia syndrome type 2, or if you are allergic to Ozempic. Stop taking Ozempic and get medical help right away if you get a lump or swelling in your neck, severe stomach pain, itching, rash, or trouble breathing. Serious side effects may include pancreatitis. Tell your doctor if you have diabetic retinopathy or vision changes. Taking Ozempic with a sulfonylurea or insulin may increase low blood sugar risk. Common side effects are nausea, vomiting, diarrhea, stomach pain, and constipation. Some side effects can lead to dehydration, which may worsen kidney problems.
Once weekly Ozempic is helping me reach my blood sugar goal.
You may pay as little as $25 per prescription. Ask your healthcare provider today about once weekly Ozempic.
The Rooms to Go anniversary sale is on. Save big on this stylish 5-piece bedroom set, just $8.88 or $15 a month, interest-free. Plus, get 40% off the matching chest when you buy the set. Just move your feet to the Rooms to Go anniversary sale going on now.
A lot of you are going to the store to shop for different items and for many different reasons. Danny Monteverde joins us live from Dornax, where it's been busier than Christmas. Is that right, Danny?
That's right, Karen. The owners here at Dornax tell me that as of today alone, they've broken their Christmas sales. Now, inside, some aisles are stocked as usual, but as we've seen so much recently, cleaning supplies, paper towels, and toilet paper are getting harder to keep on the shelves. We spoke to many shoppers today, and they all have different reasons for hitting the stores. Some just need to do the routine grocery shopping, but others say they're stocking up because of their coronavirus concerns. Now, Nicole Dornax says that while we're no strangers to emergencies like hurricanes, and it kind of feels like this in a way, we know how to stock up for that, but this is different.
With a hurricane, everybody's kind of been through a hurricane before, so they kind of know what to expect. I don't think people know what to expect with this.
This is just sort of that
the unknown.
Literal fear of the unknown.
Yes, yes.
Now, we spoke to one mental health professional at LSU Health here in New Orleans today, and there are a few things you can do if you do feel worried or anxious right now because of all the news. One is just take 1 minute to take a deep breath. She says even doing that can just lower your heart rate and make you feel calmer. Another thing to do, think about what you can still control, because right now there are a lot of unknowns and we don't know what we may be able to do or not do. So just think about what you still can control in your life. And it may be worth it to take a break from news that can be overwhelming. This is one of the first times that we've had such a major event in the digital age where you've got at your fingertips at 24/7 news and information and opinion. That really can be a little bit overwhelming. And also they say talk to friends, even if it gets to a point where there's a quarantine. And again, we are not at that point. We're all in this together, and talking about it can be as simple as that. Now, the good news is that we're told the overwhelming majority of what you need here at the grocery store, food, and those other supplies that you're looking for are here. There's no shortage of food that you may be looking for. Those cleaning supplies, though, they are on back order here at Dornax and a lot of other places, but they will get them as soon as they can. Reporting live in Metairie, Danny Monteverde, Eyewitness News.
Some fantastic tips there. Thanks so much, Danny. With nearly all sports and large entertainment options in the state shutting down, we found two of the last venues that remained open, at least as of Friday afternoon. The Fairgrounds Casino was busy Friday, although by late Friday afternoon, the track announced the rest of the season will be closed to the public, but the races will continue there. Harrah's Casino was also open, with some people getting in some gaming as a distraction to this national emergency.
Feels great to have something to do and get out. Just got to be careful and make sure you wash your hands and watch what you touch on your face, and just keep your hands clean and just keep your distance from everybody.
It looks like maybe people may be getting in their last bid before this closes down?
Yes, sir. Something like that, yeah. I guess because me too. I don't know how much longer it'll be open, so, and I just like, it's a nice place. I come here, have fun.
With circumstances changing rapidly, we don't know how much longer Harrah's is going to remain open, so stay tuned to WWL-TV for the full list of closures as they're announced.
All right, here's some good news. After President Trump unveiled a plan to fight the coronavirus in the U.S., that stock market surged. Here is a look at the closing numbers. The Dow shot up more than 1,900 points, closing at 23,186. The NASDAQ went up 673 points. The S&P 500 increased 230.
All right, shifting gears a bit now. We did see a little bit more cloud cover. It even had a few isolated showers. Not much. Rain coverage was less than 10%, and it was primarily on the North Shore. Right now, some high clouds also kind of mixed in there with some low cumulus. Really didn't have any rain on the South Shore. Current temperature is 79 degrees. Dew points have been a little bit more on the rise. We started out the week with dew points more 50s, low 60s, and those have been steadily increasing. And that just means more fog to contend with overnight tonight going into early tomorrow. Winds out of the south right now at around 11 miles an hour. We're very warm outside. Look at this, still 84 degrees up in Bogalusa, 79 degrees Slidell, 80 at Lakefront, and 76 degrees at Galliano. And we did spend a good portion of the day today in the upper 70s and did briefly get into the lower and even some mid 80s across the area. Today's high was 83 degrees. Yes, very warm and well above normal. Normal high is 71. Not quite to that record. We get close, but as I mentioned before, I think our records looking ahead will be safe as temperatures have been getting into the low 80s, upper 70s, low 80s. Generally, the records have been in the more mid and even some upper 80s, so I think our records are going to be safe for a while. Dew points, though, have been a little bit higher, more into the mid upper 60s and even a 70-degree reading over in Gonzales. What does that mean? It just means there's more moisture in the atmosphere, and normally that would mean more fuel for showers and storms, but we haven't seen many. Why is that? Well, we've had a few little light showers. You can kind of see some of those billowing cloud tops off to our northwest, more into the Florida parishes, where we have had a few lighter showers popping up really out of our viewing area. But high pressure has been dominant, and that's going to be the case over the weekend. So we are not expecting much of any rain at all. Mostly dry tonight. Again, maybe some fog developing late night and early tomorrow with temperatures dropping into the 60s. The coldest of the air is staying bottled up well to our north. As a matter of fact, the real core of the cold is staying up into Canada, and no signs of that coming down south anytime soon. And I'm talking about south in the United States. Now, as we get into the next couple of days, as I mentioned, we are going to watch this big ridge of high pressure in the Gulf of Mexico kind of maintain itself over the next several days, which will keep us mostly dry and also very warm. And that includes kind of our beyond extended day forecast. 6 to 10-day temperature outlook does call for the eastern half of the United States, more focused over parts of Georgia, Alabama, and Florida, far warmer than normal. So it does look like we're going to be ending March as a much warmer end of the season and end of the month as well. Storm track has been far to our north, again with the ridge of high pressure down to our south. We're on the outer periphery of it. Any storms kind of stay well to our north. Remember, we were also talking about a weak front that was up to our north. Well, that's going to start retreating back northward. That's what kind of helped to trigger a few isolated showers here today. That's not going to be the case tomorrow. Maybe an isolated shower on Sunday as that front kind of sinks back southward again, perhaps triggering a few showers here and there, but at the moment I'm kind of leaving us mostly dry for the coming weekend. Partly cloudy, mild and muggy overnight tonight with lows in the 60s. We do have a dense fog advisory, but at the moment it is just for the Mississippi coast. Does not include southeast Louisiana. We'll still see some patchy fog. High around 84 degrees during the day tomorrow with a mix of sun and clouds, staying mostly dry through Monday, and then we'll introduce about a spotty shower chance around 30% from St. Patrick's Day to next Friday.
No NBA games at the Smoothie King Center, but Zion Williamson making sure those workers are taken care of. Plus, the boys' state basketball championships will continue today and tomorrow under new restrictions. The latest ahead in sports.
Your local weather expert forecast is sponsored by Papa John's. Order at papajohns.com.
Who has the best local agents ready to save you money on your auto insurance? Call Dan Burkhardt Insurance today, and we'll shop several companies to get you the lowest rates for auto insurance.
Dan Burkhardt Insurance. I have always wanted to do this. This is gonna be awesome. Let's do this!
Babe, what are you doing?
Gonna demo the bathroom. Who are you?
The bath fitter installer, remember? Bath fitter custom made our new bath to fit perfectly over the old one, so there's no demo or mess.
Impressive. Wait, so no demo? Sorry, man.
Bath Fitter will remodel your bath with no messy demolition in as little as 1 day.
Call now or visit bathfitter.com for a free in-home consultation.
Martin Wine Cellar, since 1946, a thriving and committed family-owned and operated business. 73 years of maturing and perfecting our products and services like a fine wine, specializing in wine, spirits, and imported beer. Innovative expansions over the years. Gourmet food, a deli, brunch, lunch, dinner, and happy hour. Becoming a destination location, offering tastings and events, catering, and specialty gifts. Come in today. Enjoy the Martin Wine Cellar experience.
This is a legal advertisement by KRW Lawyers. Attention, if you're 55 or older, this message is for you. Millions of Americans were exposed to asbestos working in factories, oil fields, refineries, shipyards, paper mills, and other jobs prior to 1982. You may have been exposed and not even know it. Schedule your free asbestos health test and find out. Call 855-579-5299. There's no out-of-pocket cost. This is not a lawsuit against the company you work for. However, product manufacturers have been held responsible. Over $30 billion is available to compensate victims. Asbestos exposure can lead to cancer of the lungs, throat, stomach, and colon, or mesothelioma, a rare and dangerous cancer. If you or a family member work anywhere near asbestos, you may have been exposed and qualify for cash compensation. Schedule your free health test today. Call 855-579-5299 or go to krwlawyers.com.
There's no better place for seafood than New Orleans Hamburger and Seafood Company. Come enjoy one of our new Lenten specials starting at $9.99. Like savory shrimp and grits or Parmesan-crusted speckled trout topped with lump crab meat. New Orleans Hamburger and Seafood Company is your place for Lent.
Game on! It is game on at the Hyundai Spring Sales Event.
With the NBA suspending its regular season due to coronavirus concerns, 9 games at the Smoothie King Center are now in limbo. But Zion Williamson will make sure the workers at the blender are taken care of during this uncertain time. The Pels rookie posted on Instagram less than an hour ago that he will cover the salaries of every SKC employee for the next 30 days. Williamson in the post said, quote, "This is a small way for me to express my support and appreciation for these wonderful people who have been so great to me and my teammates. And hopefully we can all join together to relieve some of the stress and hardship caused by this national health crisis." The people of New Orleans have been incredibly welcoming and supportive since he was drafted by the Pels last June. That was part also of the post that he had. Following Governor John Bel Edwards' executive order restricting large gatherings, the LHSAA will not allow fans at the non-select and select boys basketball state title games. Bonneville is playing in Lake Charles tonight. They're facing Alexandria in the Class 5A final. Tip-off is at 8 o'clock. Tomorrow afternoon's Division I state title game featuring St. Aug and Scotlandville at Scotlandville High will be closed to the public. And once again, such a great gesture by the Pels rookie of covering all of those employees' salaries. Katie, I think it's something that's going to make him beloved in this city for his gesture for what he's done.
Absolutely. Thanks so much, Ricardo. And we're going to be right back with an update on the latest information on the coronavirus.
What do you think of this sofa?
Oh, it looks good. Ooh, and it's soft.
Does it look comfortable?
Try it before you buy it. At Hurwitz Mints, you'll find